day, ma'am. I am Evelyn Lanya Kimot from BSN 1B. And for today's video, what I'm going to do is I'm gonna demonstrate the Coldspaa, vital signs, assessing musculoskeletal, and also assessing neuro vital signs. So, let's start. So, good day, ma'am. I am Evelyn Lanya Kimot, your student nurse for today. So, if you don't mind, ma'am, may I know what is your name?
Leira Rialugit po.
Your age, ma'am?
23.
Your birthday po?
October 9, 1998.
So, what brings you here, ma'am?
Sumasakit na yung likod ko, ma'am.
So, when did it begin, ma'am?
1 week na din po ngayon.
So, where is it, ma'am? Saan po ito?
Dito po, sa likod, banda sa baba.
So, how does it last, ma'am?
Tumatagal po siya, pero bumabalik yung likod.
So, how bad is it, ma'am? Can you rate it 1 to 10?
Sa 6 po.
What makes it better?
Uminom pa ako ng ibuprofen.
What other symptoms occur with it? How does it affect you?
Hindi pa ako makatrabaho ng ayos.
So now, ma'am, I'm gonna take your vital signs. So first, I'm gonna check your temperature. So now, ma'am, I'm gonna take your blood pressure. So now, ma'am, I'm gonna take your pulse rate. So,
Next, I'm gonna test your respiratory rate.
So next is, I'm gonna assess the musculoskeletal. So first is the temporomandibular joint. So, can you open your mouth? Can you protrude in and out? Side by side? Do you feel any swelling or... So next is, I'm gonna assess the spine of the neck. So, can you stand up, ma'am? So, I'm gonna palpate the spine of the neck. So, do you feel any pain, ma'am? So, next is I'm gonna assess the range of motion of the neck. So, ma'am, can you move your head up and down? Side by side. Can you lay your head to your shoulder? Side by side. So next is what I'm going to do is I'm gonna assess is the shoulder. So, ma'am, can you stand up for me? So, can you move your hand up and down and up? Go to your back and relax. So, can you push against my hand? Okay. So now is I'm gonna palpate the tenderness of your shoulder down to your elbow. So, do you feel any pain to your shoulder? Ayan po. So, can you do it this? Up and down. So, can you pull against my hand? Okay. So, next is, I'm gonna palpate your wrist. So, do you feel any pain to your hand? So, now what we are going to do is, can you do this? Can you, then down, and up, and back to this. And can you try to pull against my hand? Okay. So next is what I'm going to do is assess the hips. So, ma'am, can you lay down? First is I'm gonna palpate the hips. So, can you feel any pain, ma'am? Wala po. Side. Can you feel any pain? Wala po. So, next is I'm gonna assess the legs. So, ma'am, can you move in and out? The legs. Can you do it up and down? Can you bend your knees? Can you move it in and out? Okay. Then the other side is, can you move it up and down? Can you bend it now? Can you move it out and in? Can you push against my hands to your feet? Okay. So next is I'm gonna palpate the feet and ankles of the patient. So, do you feel any pain to your feet and ankles, ma'am?
Wala po.
The other side?
Wala.
So, can you move your feet together? Out, in. Can you, and after assessing the feet and ankles, is we're moving to the knees. So, ma'am, can you up then? So, in the assessing the knees, I'm gonna palpate the knees. So, do you feel any pain about your knees now? So next, ma'am, can you stand up? And then you put your hand. So, can you move your feet front and back, side to side. Then the other side. So next is I'm gonna check the spine. So ma'am, can you stand up? So in checking the spine is I'm gonna palpate the spine all the way down. So do you feel any pain about your spine? So I'm also checking the symmetry of the shoulder, the scapula, and also the hips. So ma'am, can you bend over? So the spine of the patient is C, which is C shape is normal. So okay, ma'am. Then next is, can you put your hand to your hips and can you bend side to side, side. Then without moving your hips, can you do this? Okay. Another one. So now I'm going to assess your neurovital signs. So in taking neurovital signs, I'm going to take your olfactory. So in taking your olfactory, I'm gonna use some object and you are gonna identify what you are smelling. So can you close your eyes, ma'am? So can you identify this object?
Perfume.
So your olfactory is okay. So next is I'm going to test your optic. So in testing your optic, I'm gonna have a Snellen chart and you are going to guess what I am pointing. So
D. 0. 5. E. F. 6. 3. D.
so your optic is okay. So next is I'm gonna test your trigeminal. So can you do a smile for me? So I'm gonna palpate your masseter muscle. So there is something wrong about your face, ma'am. Do you feel any pain? So next is I'm gonna test your facial. So can you do a smile for me? Can you raise your eyebrows? Can you puff out your cheeks? Okay. So next, I'm going to test your vestibulocochlear. So in testing vestibulocochlear, I'm going to whisper some words. You are going to test what I am whispering. So
S. Patient.
so your vestibulocochlear is okay. To test your spinal accessory. So in testing the spinal accessory, I'm gonna assess the strength of your trapezius muscle. So can you push against my hands? Isa pa. Okay. So now, ma'am, I'm gonna evaluate your gait balance. So, can you stand up for me, ma'am? And can you do a walk for me, ma'am? Back. Can you hop, ma'am, with your one foot? The other side. So now I'm gonna test your coordination. So what we are going to do is the finger nose test. So can you do this for me? So, now, we are going to test the movement of your palm. So, can you close your palm? Open, close, open. So, I'm going to put some object in your palm and you are going to guess it if it is sharp or soft. So, can you close your eyes, ma'am? So, guess this object.
Sharp.
Soft. So next is, I'm gonna test your reflex. So, can I have yours? So that is how I perform the Coldspaa, taking vital signs, assessing musculoskeletal, and taking neurovital signs. So that's all. Thank you for watching.